Okay, Judith Steinberg, please.
So good morning, everyone. I'm going to start by just providing a little bit of context about HRSA, which is a lesser-known agency within Health and Human Services. We are a service delivery agency, and our mission is to improve the health of especially underserved populations through quality care, a skilled workforce, and through other innovative programs. And you're probably very familiar with some of our programs, such as the Community Health Center program, the Ryan White HIV/AIDS program, home visiting, National Health Service Corps, to name a few. So drilling down on the health center program, that's the community health centers across the country. It's really our nation's safety net for primary care delivery. Our mission is to provide accessible, affordable, high-quality, comprehensive care to people, especially underserved and vulnerable populations. And we are achieving our mission. Currently, just to share a little bit about the breadth and scale of our program, there are over 11,000 health center sites from 1,400 or so health center grantees across the country, and we in 2017 served 27 million people. That's 1 in 12 people in the United States, 1 in 3 living in poverty, and 1 in 5 living in rural areas. So I'm going to drill down a little bit more about how we are trying to support our health centers and rural communities in addressing the substance use disorders and the opioid crisis, which is really ravaging their communities. These are high-risk populations. And we begin with the health centers. Over the years, we've been supporting health centers to implement the patient-centered medical home model. And this is a model where the patient is, the entire patient's at focus, not just the medical, but also psychological and social issues. And in order to achieve that, you really need to integrate behavioral health with primary care. So we've supported health centers through grant funding and technical assistance and training over the years to add in embedded or co-located behavioral health at health centers. And it really began mostly with mental health services. But increasingly over the last several years, health centers, with our support, are adding substance use disorder services. So what we're aiming for is really a primary care approach to addressing mental health and substance use disorder services. And that's an approach that may come with less stigma, where patients have a more trusting relationship with their primary care provider and can come to that first site of care and get all services needed, or at least a big part of it, and then linked to the rest of the continuum of care. We can't do it all. So how is HRSA supporting health centers and rural communities to implement this primary care approach? Well, it begins with funding, and most recently in September we released $350 million in total to over 1,200 health centers to further integrate and expand mental health and substance use disorder services at their health centers, including providing medication-assisted treatment and behavioral health counseling. We also released awards to rural communities to form coalitions to plan and then execute a continuum of care that begins with prevention and goes through treatment and recovery within their rural areas. We're supporting workforce development. To have this kind of model of care, you need to have the workforce. So, and a behavioral health provider needs to be trained to practice in a general primary care setting. It's a very different type of setting. And so we've supported behavioral health, schools of training for behavioral health professionals and paraprofessionals for their trainees to have rotations through health centers to learn how to work on a multidisciplinary team. And that funding just went out also in September. We also expanded the National Health Service Corps to additional sites, including opioid treatment programs and other office-based treatments, as well as additional eligible providers, including master's prepared substance abuse counselors. Another arm of our another prong of our multi-pronged approach is to provide technical assistance and training. So we've supported health centers and other grantees through the use of a Project ECHO on opioid addiction treatment, and we support a substance abuse warm lines. We're also encouraging and supporting health centers and rural communities to use telehealth as a modality for increasing access to and quality of care. And we do that again through funding, through technical assistance and training. We fund regional telehealth resource centers, for example. And also we're examining our policies and making sure that they're not standing in the way of serving as barriers to telehealth implementation. And finally, in this whole circle of support that we're providing to our grantees, we are increasingly collaborating with our research partners to ensure that the questions that are relevant to the primary care delivery of substance use and mental health services are being asked and answered in our research agenda. So, what's been the impact? Well, 90% of health centers provide mental health services. This is from data in 2017, and they've provided those services to over 2 million patients. 70% of health centers offer substance use disorder services. We started collecting information about medication-assisted treatment in 2016, and so we have 2 years of data. And over that year, there's been a 65% increase in the number of patients who are receiving medication-assisted treatment through health centers, and a 75% increase in the number of providers who are eligible to prescribe. And the kinds of models that health centers are putting into place, I think, deserve further examination. They are based on that multidisciplinary team, often with a nurse care manager or a community health worker or peer, certainly a behavioral health counselor. They also have implemented on-site pain management clinics. Many of them participate in hub and spoke models, either at the state or regional or county level, or actually just within their own health center organization that may have multiple sites. And many have incorporated medication-assisted treatment into their family medicine residency programs. But there are challenges, and the first among them are recruitment and retention of data-waivered providers, as well as other members of the multidisciplinary team. And going along with that, in addition to recruitment, is the reimbursement for their services. Many of the members of the multidisciplinary team that would really aid the prescriber and support the prescriber in prescribing, and actually is often a common reason why prescribers don't prescribe. They don't have the support. Many of those members are not reimbursed by payers. So the nurse care manager, the peers working in primary care, not reimbursed for the most part. Other challenges around the complexity of care and the time intensity of this patient population. Also being able to coordinate across the continuum of care. Again, we are one component of that continuum. Stigma around in the provider organization as well as in the community is a very big issue. And also we've heard from health centers about their training needs. Oh my goodness, it's red and it's over. Okay, so I will stop there and answer other questions as they come up. Thank you.
Thank you, you're very well behaved.